The following clips are a display of the dangerous ignorance of Donald Trump, ignorance that led to the deaths of 200,000 Americans. Watch as the President of the United States embarrasses the nation once again by claiming that he knows more than Robert Redfield, the director of the Center for Disease Control, and the expert who is overseeing our country's response to the pandemic. In this next clip, Redfield clearly explains how a vaccine will be distributed to the American people.
Tell me when you think we'll have a vaccine, as best you can, ready to administer to the public, Dr. Redfield.
Well, I think as Dr. Cadillac said, I think there will be vaccine that initially be available sometime between November and December, but very limited supply and will have to be prioritized. If you're asking me when is it going to be generally available to the American public so we can begin to take advantage of vaccine to get back to our regular life, I think we're probably looking at late second quarter, third quarter, 2021. Vaccination will begin in November, December, and then we'll pick up, and it'll be in a prioritized way, those first responders and those at greatest risk for death. And then eventually that will expand. There's about, it's hard to believe, but there's about 80 million people in our country that have significant comorbidities that put themselves at risk. So
right.
They have to get vaccinated.
Now, watch as Donald Trump directly contradicts him and says Redfield is confused.
Mr. President, earlier today, Dr. Redfield confirmed that it looked like November, December, the first doses would be able to be distributed. But then he said that the vaccine for the general public likely would not be available until probably next summer, maybe even early fall. Are you comfortable with that timeline?
No, I think he made a mistake when he said that. It's just incorrect information. And I called him, and he didn't tell me that, and I think he got the message, maybe confused, maybe it was stated incorrectly. No, we're ready to go immediately as the vaccine is announced, and it could be announced in October, could be announced a little bit after October.
Clear in the way he said it.
Yeah, well, I think so, but I don't think he means that. I don't think when he said it, I believe he was confused. I'm just telling you, we're ready to go as soon as the vaccine happens.
So when do you want to see it available? What would be a timeline?
I would say
be happy
that,
with?
we will start distributing it immediately.
But to the general public. Not
To
just
the general public very shortly. Really to the general public immediately. When we go, we go. We're not looking to say, gee, in 6 months we're going to start giving it to the general public. No, we want to go immediately. No, it was an incorrect statement. I saw the statement. I called him. I said, what did you mean by that? And I think he just made a mistake. He just made a mistake. I think he misunderstood the question, probably.
You said you spoke with Dr. Redfield earlier, and you said that he made a mistake.
I think he made a mistake. Yeah,
But-
I didn't go into any great depth. I was very surprised to hear it. It doesn't really matter. Here's what does matter. We're all set to distribute immediately. As soon as that vaccine comes out that's safe and good and works, whether it's Pfizer, Johnson & Johnson, or anybody else, we are ready to distribute it very rapidly. As Scott said, and as our team knows, and they're ready. And that could be in October, sometime in October or November. I don't think it's going to be much later than that, but I think it could be sometime in October. We're ready to move, and it'll be a very full distribution, but we're going to focus also on general public very much. But our immediate aim is elderly people, and especially elderly people with heart, diabetes problems, but we will have it. We're not looking at a small distribution program. We're looking at distributing to the whole United States with an immediate focus of the elderly. Now, under no circumstance will it be as late as the doctor said, but I think that, frankly, if he analyzes, they hit him with that question, he said that we are ready at a much faster level than what he said. We will have rapid distribution. We're set up, our military and others are set up to do it, and we think it could even start taking place in October, but certainly during November, December would be the latest, because based on what we're hearing, based on what I'm hearing, results are very good.
Next, Redfield says the pandemic could be under control within weeks if people wore their masks, and that those masks are more effective than a vaccine since a vaccine works 70% of the time.
These face masks are the most important, powerful public health tool we have. And I will continue to appeal for all Americans, all individuals in our country, to embrace these face coverings. I've said it, if we did it for 6, 8, 10, 12 weeks, we'd bring this pandemic under control. These actually, we have clear scientific evidence, they work, and they are our best defense. I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine, because the immunogenicity may be 70%. And if I don't get an immune response, the vaccine's not going to protect me. This face mask will. So I do want to keep asking the American public to take the responsibility, particularly the 18 to 25-year-olds, where we're seeing the outbreak in America continue to go like this, because we haven't got the acceptance, the personal responsibility that we need for all Americans to embrace this face mask.
But according to Donald Trump's imaginary science and alternative facts, Redfield maybe didn't understand the question.
The director of the CDC also testified today that a mask, in his estimation, is guaranteed to protect the American public more from the coronavirus than a vaccine. You have, as detailed, poured a lot of resources into a vaccine development. Why not devote your energy?
And to masks.
Why not devote your energy now to a campaign to have all Americans wear a mask, something that, if more effective than a vaccine, would also help schools and the economy?
Okay, number one, it's not more effective by any means than a vaccine, and I called him about that. Those were the two things I discussed with him. And I believe that if you ask him, he would probably say that he didn't understand the question. Because I said to him, I asked him those two questions, the one question which we covered and the mask question. On masks, masks have problems too. And I talked about the masks have to be handled very gently, very carefully. I see that in restaurants there are people with masks and they're playing around with their mask and they have it, their fingers are in their mask and then they're serving with plates. I mean, I think there's a lot of problems with masks. No, vaccine is much more effective than the masks. And if we get the vaccine, we have added to the fact that our numbers are going way down. You know, you see the numbers. I'm just reading you statistics that are from wherever they get them, but they're very highly qualified statistics. But no, the mask is not as important as the vaccine. The mask perhaps helps. Don't forget, a lot of people didn't like the concept of masks initially. Dr. Fauci didn't like them, and a lot of people didn't. And I'm not knocking anybody because I understand both sides of the argument. But when I called up Robert today, I said to him, what's with the mask? He said, I think I answered that question incorrectly. I think maybe he misunderstood it. I mean, you know, you have two questions. Maybe he misunderstood both of them. But the answer to the one is it's going to be a much faster distribution than he said. Maybe he's not aware of the distribution process. It's not really his thing as much as it would be, let's say, mine. But the distribution is going to be much faster. As far as the mask is concerned, I hope that the vaccine is going to be a lot more beneficial than the mask.
The only person confused here is Donald Trump, and 200,000 Americans are dead because of it. Thanks for watching this episode of Reflect. Like this video to help it spread, and share it on your preferred social media platform. If you're new to the channel, subscribe and turn on notifications so you know when my next video comes out. For Reflect News, I'm Brendan Plank. I'll see you in the next one.